I'd wish I learned in medical school. So I am currently 53 years old and I graduated from med school 26 years ago. And yes, I know the world has changed a lot since that time, but I wanted to share with you first what I learned in med school. One thing, the key that I remember is always listen to the patient. And at the time, it was talked about we would have a lot of time to spend with patients. We would get a full medical history. And it's really funny that almost as soon as I got out of medical school, the time we got to spend with patients really went down. But that's one thing they really taught me well at medical school. And the other thing I did learn a lot about was diabetes. Now I'm a nutritionist as well, that's my undergrad. So I always had an understanding of nutrition. And diabetes, 26 years ago, things have changed a little bit since then. But what are some of the things that I didn't learn when I was in medical school that I wish I knew more of? So number one is about hormones. So I'm a woman, and you know something? In medical school, we learn the basics of the menstrual cycle, but we really don't go into depth of what is truly happening. And even as a woman, you would think that I would know better, but it wasn't until I started going through perimenopause, which was just over 10 years ago, that I really dove a lot deeper into the menstrual cycle. At the time when I went through medical school, basically anyone that would come in that would have abnormal cycles, we were just told to put them on the birth control pill. And often that's what I did 20 plus years ago. But now the birth control pill is the last thing that I will give women without an informed discussion of why they're taking the pill. And why is that important? We know now that the birth control pill can have a lot of risks and side effects. Many of you may not be aware of the added clotting risk that comes with the birth control. And this is because when you take a pill form of estrogen, it raises the blood clotting in your system. But we can actually screen if a woman has a family history for bleeding disorders. So maybe your aunt or mother had blood clots. A girl can be tested for something called protein C and S deficiency. Because if you have that and you on the birth control pill, you are a much more heightened risk for blood clot. So this is something to be aware of. Also, we know that menstrual cycle or the birth control pill, especially when it started early, and we're talking about now girls in 14, 15, 16, that it's going to predispose them as well to osteoporosis. And then the other that we know about is Depo-Provera. For so many years, it was given without any type of bone protection, but that's the 3-month injectable birth control. And now we know it causes a lot of weight gain. It can cause advanced mood disorders and depression, but also it really contributes to osteoporosis. So I wish I'd known more about that, but I know now. So this is why I'm telling you. The other is about menstrual pain and bleeding. Once again, all we were basically taught was put people on the birth control pill. And, personally, I speak from experience because I do and did have endometriosis. So for many years, yes, the birth control pill helped me, but I stopped the birth control pill because I had migraines, which is something that we don't talk a lot. And my migraines improved off of birth control, but my menstrual cycles didn't. I found out on my own that when I changed my diet, that I had an improvement in my symptoms. But so many women and girls are suffering. So there are ways, and there's things that we know now, endometriosis, adenomyosis, the connection with the gut, and things that can be done to help overcome these problems rather than just going on the birth control pill. And again, the pill is used in millions of women all over the world, but what we're starting to see, and I believe, is that a lot more of our cases of infertility are happening because women just get slapped on the birth control pill without any looking for the root cause of the problem. Then in their 30s, they're coming off of the pill and they're wondering why they're having trouble getting pregnant. So hormones are one of my big things I wished I'd learned. The next would be gut. So of course we learned about the basics that if someone has heartburn, talk to them about their diet. And it kind of went from there. And then we learned about irritable bowel syndrome. But we really didn't have treatments for irritable bowel. We had some pills that we would put them on. But what do we know now? In 2024, we know about the microbiome. So we know about all the bacteria that are living inside of us, trillions of bacteria and funguses. and they live with us. But when they are not happy, our body is not happy. So we know now of the condition called SIBO, small intestine bacterial overgrowth. And we know that 70 to 80% of the cases of irritable bowel, which is just a blanket diagnosis for something in medicine that we don't understand, that they're caused by SIBO. And what you may not know is that we have treatments, appropriate treatments for SIBO, so that you can overcome it for good rather than going on stomach medications or bowel medications for the rest of your life. We have access to a breath test, which is supported in evidence, and we have both antibiotics and we have herbal medications that can be helpful for SIBO. The other thing I didn't learn about from the gut perspective was something called leaky gut. So again, this is many cases of irritable bowel, constant gas and bloating, and there can be issues related both to gluten, which is wheat, and it can be related to dairy. So a lot of celiac disease is rising. They say now 1 in 100 cases of people have celiac disease. But there's even a greater number of people that can have non-celiac gluten sensitivity. And the only way that you're going to know about this is when you eliminate gluten. Now, part of the issue is the gluten. It's the gliadin in the wheat, because now we're using a lot of GMO wheat. That's one of the problems. The other problem is that a lot of the wheat, well, in North America, wheat is sprayed with glyphosate. So this is pesticide, also known as Roundup. In Europe, glyphosate is banned to be used, but it's still widely used here in North America. So some of the sensitivities are related to the glyphosate and not the gluten. But these are things I never learned, and now I have learned, and I want you to be informed. As well as the dairy, we also know that lactose intolerance can be common where people don't break down the sugar, lactose. But for other individuals, it can actually be an antibody mediated reaction from dairy. So for people I see with chronic constipation, with acne, with asthma, this can be an eczema, of course. This can be a dairy-mediated allergy. This is something I didn't learn, but I know now. The other thing I didn't learn in medical school is how to approach the body from a symptom perspective. So when I was trained in med school, so we have the GI, the gastrointestinal system, the endocrinology system, we have the nervous system, and we have the brain, and all those hormones. We have all of our body systems, a musculoskeletal system, but we don't learn about the connections from one to the other. So what happens is we learn that when you get sore bones, you go on an anti-inflammatory. And then when you get a sore stomach, you go on an antacid pill. And when you get soft bones from osteoporosis, you go on another medication. But no one told you that when you went on that stomach medication, it was going to predispose you to having osteoporosis. So now the way I see medicine, and actually the way that I've always been thought in my mind to see the patient is from a whole person perspective, is I see it from a systems-based approach. And what this means is that what happens in one part of the body affects the other part of the body. And you might ask, well, why don't doctors get into this? And part of it is the way that we are trained. And even to this day, doctors are trained in a disease-specific manner. So you treat one disease, you go to one specialist. For the next disease, you go to the next specialist. I see this a lot. But in my practice, where I practice functional medicine, which is a holistic approach to the person, I'm actually looking for all of those connections. So for example, I have a patient that's having neuropathy, numbness and tingling. So I found out that she had early menopause. She wasn't on appropriate hormone replacement because of her early menopause. She had gut issues and low vitamin B12. She's not absorbing her B12 because of her gut issues. So now we're looking at a systems-based approach to her care because she's seen specialists and no one's been able to figure out her conditions because no one looks at all the pieces of the puzzle. So more and more, this is going to be what's happening in medicine. I think functional medicine is leading the way. You know, there's a lot more of us getting trained this way to think as a body of a whole. And it's affected by one part will affect the rest. So we have to get away from this Western style of medicine of just a pill for every ill. So if we're wondering why healthcare is getting so expensive, it's just because of that, because we're searching for a tablet to take away our symptoms. But what we really need to do is we have to empower patients, we have to educate them, which is why I'm so happy to be here today to talk to you so that you can understand what's going on in your body and what you can do to make the changes that you need so that you don't need to go to medications, that you can heal your body from within, because healing is possible. And then the last thing I wanted to talk about, which we didn't really learn, was about essential nutrients. So yes, we learned about amino acids, we learned about protein, and we learned that we need certain amounts of food. And even, given that I'm a nutritionist, so 4 extra years in nutrition, I didn't realize the impact of 3 key important nutrients in our body. One of them is vitamin D. And we can measure this through a blood test through any of your physician's offices. So vitamin D is essential for our metabolism, it's essential for our mood, and it's essential for our immune system. So we know that women with multiple sclerosis can have very low levels of vitamin D. Very low levels of vitamin D, we see that in women with breast cancer. And we also saw very low levels of D in women that did and men that did very poorly with COVID. And that's because vitamin D is really a pro-hormone in our body. So what's supposed to happen with vitamin D? We get out in the sunshine, the sun shines on our skin, and we convert the chemicals into vitamin D, and then it acts like a hormone in the rest of our body. Well, when we're in North America, we really have a problem with this. And look at me now, I'm in Canada, I'm so pale, and I'm gonna get more pale as the winter goes on. So I need to take vitamin D, and most North Americans do need to take it. And in medicine, we know it's important, and maybe your doctor may have said, take 1,000 or 2,000 units, which is great, and that can help a lot of patients. But if you have any specific health problem, I really think you need to get a vitamin D level done. And why is that? Because another thing I didn't learn in med school is that many people can have a vitamin D genetic receptor issue. And next to getting your genes tested, getting your blood level done can be really important, because I see a lot of individuals with vitamin D levels in their boots. So in Canada, if you're listening, I see levels in 40, 50, 60. In Bermuda, if you're listening, I see levels in like 10, 20, and 30. If you have a super low vitamin D level, you're going to need higher than normal doses, and sometimes up to 5,000 units a day to get you into a therapeutic range. Or you may need higher prescription strength levels to get you into that range. So it's super important to get that level checked. Even though I will let you know our Canadian guidelines do say that you don't have to have your vitamin D levels checked unless you have something like osteoporosis. But when you dive deep into the literature, we can definitely see the increased association of diseases with those that have low vitamin D levels. The other essential nutrient that you need to get tested is vitamin B12. So why is this? Vitamin B12, many of you might have heard of it because you think vitamin B12 can give you energy, which is true, but many people can have vitamin B12 deficiencies for a variety of reasons. So who has a deficient level? So number one, if you're vegetarian, if you're not eating any meat, then you need to supplement. Number two, if you're taking metformin, metformin predisposes you that you don't absorb vitamin B12 very well, and you can have a low level. The diabetic guidelines tell us if you're on metformin that we as physicians should be checking your level at least once a year. The other time I see this is with people that have gastrointestinal disorders where they're not absorbing well. So this can be Crohn's or colitis, but it can also be people with chronic constipation or simply chronic diarrhea that's not been diagnosed. So then it can be an absorption issue. So the other time we see vitamin B12 that can be low is if you have a genetic predisposition. So once again, I've had my genes tested. I have a genetic defect called MTHFR. So this condition is called a methylation defect, but 30% of the population can have it. So sometimes we ask, well, how do people ever survive before? Or why is cancer increasing? You know, we know that there's definitely a lot of things in our environment that can predispose us to cancer, but also we know now that genetically we carry these genes, but because of our lifestyles, these genes may be inactive or active. But if 30% of the population can have this genetic problem with B12, it actually can be linked to having a lot longer term and other complications within our body. So, for example, for me, I was glad to know this. My father had early heart disease, and I feel that this is a methylation-based issue, most likely within our family, that I probably inherited from him. So this is one that you may not know unless you get tested. And then the last nutrient that I say that we really need to talk about is omega-3 or fish oil. Now, up until now, most of you probably were not aware that we can actually test for omega-3. So we are able to get what's called an omega-3 to 6 ratio. So when we look at cardiovascular disease or heart disease, most of you know that if you go and have your cholesterol done, if it's high, you're going to have risk of heart disease. If you have diabetes, you're going to have a higher risk of heart disease. But the omega-3 to 6 ratio is a direct predictor of heart disease risk. So what does this mean? So in our food chain right now, most of us don't eat a lot of deep water fish, so fatty fish, so salmon, sardines, and mackerel. So you're probably thinking, oh my, I can't even stand the smell of them. Or you're thinking, I just don't eat fish at all. So then what you're eating, you're primarily getting a diet of omega-6s. So 6s come from nuts and seeds, which can be healthy, but they also come from things like a lot of canola oil, seed oil, which is used to fry things, which is used in a lot of processed foods. So then what happens? Your 3 to 6 ratio becomes out of balance. You have way too much 6 and not enough 3. So many of you might be taking an omega-3 supplement now, and you heard it was good for you. Some people are taking an omega-3, 6, and 9 supplement, which you definitely need to stop taking. But what if you could be tested to not only know what your ratio was, but also then take a supplement that would actually improve your ratio of omega-3 to 6? So this is a key essential nutrient to health. Why is it important? It's responsible for heart risk, for brain inflammation, for memory, for concentration, for Alzheimer's disease. It is essential that you know what your number is. So those top 3, we touched on them in medical school, but I have much greater knowledge of them now in 2024 than I've ever had at any point in my life. Vitamin D, vitamin B12, and omega-3. So I hope this has been helpful for you to realize some of the things I didn't know in medical school, some of my practices that have changed because of where I am now in 2024. So many people have asked me about this. So Dr. Keenan, what are the essential vitamins that I need, and what are the essential blood tests? So I've designed a lecture. It's going to be free, and it's going to be held this upcoming Monday at 7 o'clock. So I'm going to do it by Zoom so that you're going to be able to ask questions afterward, but I'm also going to broadcast it live on Facebook for those that are interested, so that they can get more information for those that are inside my Facebook group. So I'll be posting the link soon to register for that. And I'm going to go through the specific tests that you need and how you get tested for them. What is the way to do that? Because when it comes to our health, knowledge is power. And you can think that you're healthy, and many people do, but then they find out that they have cancer tomorrow, or they find out that they have heart disease the hard way by having a heart attack. So an ounce of prevention can be worth a pound of cure. And when it comes to health, these are really some of the fundamental things that you need to know about your body. And then once you know that, then you can learn what you can do to overcome these issues. You can learn, do you need to supplement? Because with vitamin D and omega-3, I would say everyone needs to be supplementing in North America. But if you want to know how much and what your levels are, so stay tuned. Please tune in for the webinar Monday night at 7 o'clock. I'll post the link soon. And please feel free to send me any comments below. And if you have questions, feel free to send them along. I hope you had a great day and really enjoyed this being here with you all. Take care. Bye for now.